even a moment of power cut, and we are all aware that there is no life. AC is off, fan is off, kitchen is stuck, mixers are not working. So everywhere we are using electricity, and contemporary life cannot even be imagined without electricity. But sometimes this electricity can be fatal as well. And across the globe, we are having millions of cases every year of electrocution. I'm Dr. Pranav, public health scientist and health educator, and today I will be talking about how to respond to a electricity shock, electrocution injury. So, as we know, electricity is a current flow between 2 points, and this flows at very high voltage between the transformers and where the power is generated, and then at lower voltages, many places 110 volt, and many places like in India 220-volt power is supplied for house appliances and all the things for our day-to-day use. Sometimes when accidentally either there is a electricity wire that is stripped off, so there is a naked wire which is conducting current, and we get in touch with the current, like you are working with some washing machine, or you are working with some plug, or there is some fluid which accidentally connected, or in bathroom you had a electric shock, or maybe you had some small children who accidentally put their small finger inside the power plug. It can come, the electric shock can come in multiple different way, but it is extremely disastrous. Why it is so disastrous? Because one, our whole human body functions physiologically on very micro current. So even if I'm able to make my fingers move, or if I'm able to see the world, everywhere electrical signals are involved, everywhere. Now when you have electrical current at very flowing at very high voltage, then everything electrical inside our body, and that is every cell of our body, is electrically involved. Complete functions go haywire. Your heart can stop functioning, your muscles can twitch in a way that it makes movement and anything absolutely disastrous. Patient can get into shock. So we need to understand how to respond. Now, electrical injury can be generally can be classified in three ways. But before that, the most important thing I want you to learn is, if there is an electricity shock, if a person touches the victim to remove him from electric contact, chances are you also can get electrocuted. You can also get electrical shock if you are trying to remove physically one person who is having an electric shock. So, number one thing, if a electric plug can be identified of the appliance from which the victim has got electricity shock, it should be removed from the plug. Suppose someone has got electric shock from a microwave oven or electricity oven, then remove the oven's plug from electricity shock, number one. If you don't understand what can be the reason, try and go to the power supply place where you have got MCB, and there put it in down position so that whole house there is no power. That is number one step. Number two, many times you don't know where is the power switches where you can remove it and put it down so that power is stopped from flowing across the house. Then the next best thing what you can do is, make sure your hands are dry. Make sure you are wearing a dry rubber slipper or dry slipper of leather. but it should be non-conductor, and you should never approach the victim without any slipper, because then again you can get electrical shock. Then once you have ensured that you are wearing a non-conductor, that is leather or rubber slipper which is absolutely dry, put something on your hands, cover your hands with some rubber thing or thick cotton clothing, and then try to remove the patient, but make sure you are never coming directly in touch with the patient. But as I said, it is the second best option. The first best always is to remove the appliance which is giving electrical shock from electrical power position or stopping the power supply across the house. Then there can be another option. You throw some towel around the patient and try to remove the patient, catching hold of only the towel. Once you have removed the patient from electrical contact, now comes the critical step of identifying what exactly is the condition of patient. So first look at the breathing, get close to the patient, see if patient is breathing but is unconscious, put the patient in recovery position. If the patient is unconscious and not breathing, you should perform CPR, or you should come in contact with someone who can perform CPR, and side by side request for emergency care. You can phone to some hospital for providing ambulance or any other service, so that patient gets best treatment of hospitalization as quickly and as possible. And in between, when the emergency care is yet to arrive, you should perform CPR on the patient who is unconscious and who is not breathing. Now coming to the most common condition where the patient is conscious, patient is breathing, then like it happens mostly with children, small children who got an electric shock when they put their fingers in electrical plug. Make sure open their hands, make sure to see whether there is any sign of burn, because electric wire or any plug can also leave a burn sign. So remove if and open their hands and see if there is any sign of burn. If there is a burn, put the hands under running water for 10 to 15 minutes. Then apply a solution that can disinfect the patient. Like if you have povidone, you can apply povidone, or if you have got silver salzide, you can provide that. For our episode on burn injury, you can see another video in our playlist. So that is the treatment for someone who has got electrical shock but is still conscious, be it children, be it adult. The trickier part about the people who are conscious, who are but they are not conscious but they are having the breathing intact. Now you should put them in recovery position. We have got a separate video on recovery position, but essentially it is like you fold the knee of the patient towards their chest, roll the patient to one side, tilt their heads backward, and try and open the patient's mouth in such a way that breathing is easier. So that is called recovery position. So I hope again, I think there is a need to summarize everything. So electrical shock can give the patient three different states. As a onlooker or at a first aid service provider, you should find out if the patient has got consciousness or not, if the patient is able to talk or not. If the patient is able to talk, patient is conscious, then see if there is a electrical burn sign. If there is electrical burn sign, go for burn care. If the patient is not conscious but still breathing, put the patient in recovery condition. If the patient is unconscious and there is no breathing, call the emergency, and in between provide CPR till the patient is able to get emergency care. If you have got any other question, any doubt, you can contact us on the number provided below. We'll be happy to help you. If you found this video helpful, please subscribe and share between your friends so that we know how to cope and how to deal with electrical shock. Thank you.